Hi. You called because you're not feeling too well. Okay, don't worry. I'm here to take good care of you. So, what's been going on? Ah, yes, a classic winter flu. Okay. Could you just confirm your name for me? Okay. Wonderful. And if you could just describe the kind of symptoms that you've been having and for how many days? Okay. When's the last time you checked your temperature? Alright, let's do that right away. Just so I can see if you have a fever. Do you have a headache? You do, okay. Have you managed to get any sleep at all tonight? Tossing and turning, yeah. It can be quite difficult to sleep when you have a fever, especially, so. Alright, let's go ahead and check. Just get comfortable, okay? I'll make this as relaxing as possible. So, hopefully, at least after I leave, you feel a little bit more relaxed. This is just gonna go right on your forehead, okay? So just hold still. Yes, that is 38.7 Celsius, quite high. I'm just gonna check one more time just to be sure. Yes, the same 38.7. Okay, no wonder you're not feeling well. Just note that down. And do you have any other symptoms? Stiff neck, cough, any dizziness or nausea? Yeah, a cough. Would you say it's more of a dry or a wet cough? Yeah, like some mucus. Yeah, okay. And for how many days did you say you've been feeling this way? About 3 days. Okay. Doesn't concern me too much, just seems like a classic viral infection. Okay, so antibiotics wouldn't help in this case. Rest, ibuprofen if you need it, lots of fluids. Alright, you're a little bit congested too. Here. I have some tissues for you. Let's just make sure that you're nice and comfortable before we start your exam. Okay. You can keep this packet. Would you like one now? If you feel too weak to, I'll wipe your nose for you. Don't even worry about it. That's what I'm here for. Okay, yeah, you can keep this next to your bed. And you don't even have a tea or water, so we'll definitely pour you a drink. Poor thing. I know it's hard to take care of yourself when you're alone. Just wipe your nose really quickly. There you go. Yeah, it seems like you're at the peak of it, so after tonight, I'm sure it'll turn around for you. But just to be sure that there's nothing too serious going on, I'll give you a physical checkup. Okay. Here you go. And I'll just pour you some water. Okay, have to stay hydrated. Okay. Sorry if that was a little loud for your head. So, you're gonna take a sip of this for me. There you go. vaccination spray just all over my face, like a soothing, calm mist. So, would you like some of this? Yeah. Okay. Spritz this around you. Comfort is key when you are getting over a flu or a severe cold. Just gonna have to let the sickness do its thing. I know it's uncomfortable, difficult, but okay, I'll just shield your eyes for a moment. Spritz this around your face. Okay, and a little bit more. Okay. Yeah, it's nice. Okay. And one more thing I'll give you before we get started with your exam. Since you mentioned kind of a cough, I always recommend cough drops, but these especially, they're like a menthol cough drop. So they give you that freshness to kind of clear your airways and your sinuses a little bit when you're feeling sick. Yeah. These are just from Ricola. Okay, would you like one? Yeah, why don't we take it now and let it kind of sit in your mouth, and then I'll make sure that you don't fall asleep with it in your mouth before I leave, okay? Okay, just put that right in your mouth there. It's kind of like candy, but yeah, pretty strong. Okay, should help though. Alright, so now that we made you feel a little bit more comfortable, just go ahead and relax. I'm gonna check some of your vitals, okay? Just to be sure, do you know if your vaccinations are up to date? Okay, just want to make sure. If your fever persists for another day, I want you to call me and we can do like a 3-in-1 combination testing for things like corona or influenza. Could be bronchitis. There's a lot of things, a lot of viruses going around lately, so. Okay. Any trouble breathing? Any tightness in the chest at all? No? Okay, that's a very good sign. Okay, and what about your appetite? Are you hungry at all? Not too much? Okay, that's fine. That's expected. Totally normal. As long as you're staying hydrated. Okay? When your appetite comes back in the next couple of days, you can just focus on light foods, bread, applesauce, things like that. Whatever you have a craving for is totally fine. Okay. Alright, so let's start by checking your breathing. Just to make sure. So. And I'll listen to your lungs. Okay. Just try to warm this up for a second. Might be a little cold on your skin. I'm just going to kind of expose your chest here. Super cozy pajamas you have on. I like those. Right, just holding this on your chest and just breathe normally for me. Good. A little bit lower. Okay, good. And over here. Okay. Alright. Can you take a deep breath in for me through your nose? Yeah, a little congested. That's okay. Okay, and let it out. Yeah, sorry. Let it out. Okay, good. And another deep breath in for me through your nose. And let it out through your mouth. breath in for me. And let it out. And another deep breath in for me. And let it out. You're doing great. And another deep breath in for me. And let it out. Wonderful. All sounds fine with your lungs. You don't struggle with asthma or anything. Okay. If you were, I'd recommend you continue to use your inhaler, but since you don't, that's okay. I'm just gonna listen around the back here. Okay. And take another deep breath in for me. And let it out. And one more deep breath in for me. Good. And let it out. Okay. Excellent. Everything sounds totally normal. So that's a great sign. Okay, and about how often are you coughing? When you move? Okay. Not too often though. Okay, good. And when you cough, are you coughing up anything? Sometimes. Okay, more today than yesterday. Okay, that's a good sign as well. Could be running its course and your body's just reacting as it should be. Okay. Quickly feel your glands. Just hold still. Yeah, quite swollen. And you do feel warm to the touch. Okay, as expected with the fever, but you may experience hot flashes and then chills. Again, totally normal, okay? Yeah, don't worry. And you mentioned no stiffness in your neck. Okay. Okay. Any pain down the arms, down the limbs? Okay, good. And any soreness in the back? Okay, very good. Okay, just the head. Okay, I have something I can give you at the end for that as well. Alright. Go ahead and check your pulse. So I'm just going to feel on your neck here. Just relax. Okay. It's very good. And your blood pressure, really quickly. Just have this cuff here. It's just going to go and apply some pressure on your arm. Just undo the Velcro here. Okay. And wrapping this just around your forearm, just like this. Is that comfortable? Okay, just gonna turn it on. If it's too tight, just let me know. Ready? Okay. It's okay? Alright. Perfect. Your blood pressure is totally healthy and normal. Good range there. Okay, so very good. So those are your vitals all done. Now I just want to check your eyes and do a quick little mini nerve exam and test your orientation. Can you tell me just what day it is today? Very good. Alright, so can you follow my finger with your eyes? You're doing Great job. Just watching how your eyes can track moving object. Alright, any pain with that? Any double vision? No, okay. Can you just look at the tip of my pencil? Can you just follow it into the tip of your nose? And back out. Okay, and again into the tip of your nose. And back out. Very good. I'm going to bring in a light. Just take a look at your eyes. So just look behind me. Okay, you can look at the stars if you want to. By the way, I love what you did decorating your place. Very festive. Okay, so again, just don't look at the light. I'm just going to hold your eyes open very gently. Okay, good. And looking at the other eye, just checking, taking a close look. Alright, so you can blink if you need to. I'm just gonna check your pupils here, just covering up one eye. Okay, very good. Okay, and the other might be a little bit bright. Pupils are dilating normally. Did you go a bit blurry there? Okay. If you can, just follow this light with your eyes. Very good. Follow it up and down. Just hold your head so you don't move. And side to side. Alright, I'm looking at the tip of my nose. Can you tell me when the light comes into your vision? Good. Okay. Good. Good. Very nice. Okay. Do you mind if I touch around on your face? Okay, just for a moment. I just want to feel if there's any swelling or tenderness, especially around the eyes here. Okay, just for a moment. Okay. Okay. I'm just gonna pull. Can you look up for me? Excellent. Can you look down? Good. Can you look to the left? And can you look to the right? Fantastic. Okay. Eyes look fine. Perfect. Are you doing okay? Good. Good. We're getting there, okay? And next, I just want to test your ears, nose, and throat. Very important for the flu. Alright. Just one more thing. Can you hold my two fingers and squeeze? Just with your hands. Okay. Can you squeeze a little bit harder? Good, okay. So, strength is decent. Good. Alright. So, if I could just take a look at your ears. Let me just tuck your hair behind your ears here. Have you had any problems hearing me? I hope not. That would have been a little awkward. Okay, I'm just going to take a closer look inside each of your ears. Feel free to just tilt your head a little bit. Thank you. Okay, so I'm just going And if you close your eyes for me, try not to sleep just yet. Can you tell me on which side you hear my gloves? Okay. Very good. Left. Right. Both. Right. Right. And left. Okay. Now I'm going to whisper some numbers into each of your ears. You could repeat them back to me. 5, 7, 2. Good. 8, 3, 6. Good. 9, 1, 4. Okay, one more time. 5, 3, 8. Well done. Okay. Now I just want to take a look up your nose. I know it might be a little uncomfortable since you are congested. I'm just going to go in with my light again. You can tilt your head back slightly. Okay, I'm just going to take a peek up your nostrils here. Oh yeah, okay. Yep, I'll definitely leave these tissues here with you. But that's okay. Okay. Can you just hold one side and breathe in? Oh goodness, okay. And the other side. Yeah. Okay. Here, let me just help you out there for a moment. Okay. Let's do a quick sniff test. See if we can manage. Close your eyes. Can you try to identify this scent? I'll give you a hint, they are festive. This one is, can you be more specific? Yes, that is orange and cinnamon. Well done. Okay. Next one. Okay, what do you think about that one? Vanilla sugar cookie. Excellent. Okay, so you haven't lost your sense of smell. And one more here. Good. That is pine. Well done. Okay, so I'm thinking this may be influenza, but let's have a look at your throat. Where's my swab? My throat stick. Okay, we can have a look inside. If you can just stick your tongue out, taking a peek at the back of your throat. Say ah, ah. Good, good. Okay, yeah, irritated probably from your cough. I see kind of a buildup of mucus back there. Yeah, lovely. Don't worry, I'm a doctor. I've seen much worse. Yeah. Okay, how's that cough drop doing for you? Yeah, good. You enjoying that? Okay. Yeah, it's helping you breathe a little bit better. Wonderful. I am going to take a swab while I'm here so that I can check for what your virus is. And then I'll let you know what the results are in the morning once I get that tested. Okay, open up again. I'm just gonna swab the inside of your mouth here, kind of at the back of your throat. You're doing a great job. nose, sense of smell. It's fine. Some slight throat irritation. Okay. And I'm just feeling the sinuses near the nose. And up here. Okay, a little bit of sinus pressure and pain. Should reduce by tomorrow, hopefully. Okay, so we are just about done with the physical check. I didn't see anything concerning. Again, just looks like the common winter flu to me, so stay hydrated, okay? Make sure you drink your water. Lots of rest, lots of chillin'. Maybe find a new TV series or watch some Christmas movies. Just make sure you stay in bed or on the couch. Get lots and lots of rest. Okay. And if you are hungry tomorrow, just have some lighter foods. Yeah. Okay. So for your headache, I will leave you with this roll-on. This can be really helpful for reducing Kopfschmerzen, headaches. Okay, so it's just like a little gel that goes on your temples. Do you want to try that out? Sure. Just looks like this. So I will leave this here with you. No problem. Ooh, actually smells really nice, calming. Alright, just gonna put that right there, tip of your temple there, and the other side, right there. Good, good, good. And just a tap on your neck here. Help you sleep. Okay. Good. It's kind of minty. Recommend perhaps a chest vapor rub since you are congested there. So I brought one with me. Would you like a quick application? Sure. Okay. Yeah, just kind of on your upper chest to soothe that area and help reduce cough. Yes. Okay. Yeah, so as mentioned, this is just a vapor rub, so I can leave this with you as well. I'm gonna rub that gently onto your chest, opening up your airways. Yeah, you get a special treatment when you get a visit from the home doctor. I'm glad that, I suppose I'm not glad that you're sick, but it's good that you are sick the week prior to the holidays, so hopefully you can get over this in time for all the festivities. Okay. Feeling better already? Good, good, good. I'm gonna remove my gloves now. And lastly, since I suspected you're not sleeping too well, I would be happy to give you a quick little lavender hand cream. A quick massage on your hands. Yeah? Okay. This one is a Gute Nacht, Gute Nacht, Gute Nacht 2-in-1 hand cream and mask with grape and shea butter for sehr trockene Haut. very dry skin. So let me see your hands. Oh yeah, a little crusty. Okay. This should do the trick. Okay. So just rub that in. Oh, yeah. And then we're just about done. So you are free to relax after this. My sleeve is in the way a little bit. There we go. This hand. Okay. Well, I'm really glad that you called me in so I could take care of you. Yeah, it's important to ask for help when you're not feeling well. It's my pleasure. I enjoy nursing people back to health. Okay. Alright, let me just rub the rest to my own hands. Is there anything else I can get you or do for you tonight? You're all set, ready to sleep, I figured. Okay. Again, I'm not concerned. I don't think you have any kind of bacterial infection. As I said, it does sound completely viral to me, so just make a note if the pencil doesn't slip out of my hands. So, I would suggest taking ibuprofen if your headache is too severe, if your fever peaks any higher than 39 Celsius, then that would be a good time to take some ibuprofen to help for comfort, okay? Yeah? Alright. Oh,